Sculptra to the cheek areas. He's got a little malar deficiency, and you want to increase the amount of fullness to his cheeks and the infraorbital area. First, I'm actually going to apply some topical numbing cream to the cheeks, and we will have the patient have this application on for approximately 30 minutes, after which time we will wipe it off and start the procedure. The patient has also been off medications that would thin out his blood and make him bruise more easily, such as aspirin and non-steroidals, such as ibuprofen, Motrin, and Advil. Once the procedure is done with Sculptra, it is very important for the patient to follow instructions, and one of the most important instructions is post-procedure massage. He is going to need to massage this area pretty vigorously, and we'll actually do a massage once the procedure is done so the patient knows how deeply. He needs to do this quite vigorously, 5 times a day, 5 minutes for 5 days. And this is so that it will help distribute the product more evenly and help prevent any side effects as lumpiness. For approximately 30 minutes, we're going to wipe off the topical anesthetic. Keep your eyes closed. And the area we're actually going to concentrate is really this medial cheek, lateral cheek, and the infraorbital area. You can see he's got some hollowing of the infraorbital area here, and we're going to concentrate right there. Again, actually, I think on his left side he's got more deficiency in this area. He's got some fullness in this area. Sculptra that has been initially hydrated with sterile water, and then has 1 cc of lidocaine, and this is a total of 1 vial. I will end up using maybe 60% of this on his left side and about 40% on the right side.
Should I put my head back or no?
Are you overlap? Yeah, you're fine. You're good.
It's going to hurt.
As you can see, the tissues instantly get plumped up. Obviously, some of this is just the water effect, hydration effect. And what I'm doing with my other hand, other finger, is actually protecting the globe, and this is extremely important. When you're injecting around the eye, obviously, and my finger is actually at the orbital rim, protecting the globe. Injections are placed quite deep. This is really more to augment his lateral cheek. So we're done with this side. So we're actually done now. Now we're going to massage these areas. want to go ahead and distribute this more evenly in the tissues. And secondly, also we want to show the patient how this works. Okay, turn it off. The patient actually did really well with injections. How do you feel now?
Oh, fine. Yeah, not too bad.
Okay.
Yeah,
Usually the first two shots
Yeah,
or
it was
so
okay.
hurt the most because even though the skin is numb, it's deeper, you feel some pain. But once the shots are in and the lidocaine's in, then things
It's okay.
work.
Yeah.
It ends up being quite tolerable. It is over sensitive areas. The infraorbital nerve exits about there, and so it's a very sensitive area of the cheek. So right now, this is the massage we're doing. As you see, it's pretty deep.
Feels good.
But this is to distribute the product evenly within the tissues. And so this is what I want the patient to do. 5 minutes a time. So about 2.5 minutes each cheek. 5 times a day for 5 days.
Working
And
out.
by using this technique of dilution, injection, and massage, we haven't noticed any severe side effects at all. It is not uncommon to certainly have some bruising and some swelling, and those are actually more expected than even complications. They're just side effects of the procedure, since it does involve a lot of injections into tissues that are quite vascular. You had a question?
Yeah, what about working, exercising?
In exercising, I'm going to say in about 48 hours you can start exercising. For the first 48 hours, certainly the first 24 hours, take it easy, just because the area is a little swollen. So the patient really will not notice any long-term improvement. Right now, the cheeks look full because obviously there's a lot of hydration in that area, and so the injection causes the fullness. In about 3 to 4 days, when this gets completely absorbed, the patient may feel like his cheeks look like they were back to normal. But usually around 5 to 6 weeks, you will start noticing early on the skin feels and looks better, thicker, and then after that you will actually get a little improvement of the tissues, with more fullness of the tissues in these areas. And so for the patient, we'll actually see him back in 2 months to evaluate and see if he needs any more injections, if and when he needs any more injections.